Its cause is unknown. It can render children speechless and strip them of the ability to do basic tasks. The Centers for Disease Control reports that 1 in every 150 children is diagnosed with it, autism. Every case is different, making it difficult to pinpoint any one reason for its existence. But what experts universally agree on is that early intervention is the most important action parents can take.
It's important for all parents to understand typical development, basic developmental milestones, and for autism, what might be early signs would be a lack of smile or social expression at 6 months. At 12 months, lack of babbling or intentional pointing to some of their favorite objects. And then when we get to 18 months, oftentimes there will be words that are being lost in their vocabulary or social responding. That's becoming less and less noticeable by families, and that's usually when we see the biggest concern. For most children with autism, most of their early intervention is happening prior to age 3. Most of our brain development, especially in language and social skills, is happening from birth to age 3.
Once a child is diagnosed, the introduction of intensive therapies in language and social development are the key factors in helping a child rise above the deficits caused by autism.
My turn.
The primary method used is something called applied behavior analysis.
Applied behavior analysis, in a nutshell, is the science of teaching. It's breaking teaching down to basically step by step what a child needs to learn to develop a skill. Using reinforcement to increase behavior, and modern ABA in particularly looks at setting specific behavior, working within natural routines, and being able to teach behavior in the most motivating way for children. It's considered the gold standard primarily because of the amount of research that's been done on how effective ABA methods are.
Finding a treatment facility with a solid background in applied behavior analysis isn't always easy. Many companies claim to have the latest and greatest treatment options, leaving families vulnerable to ineffective and untested methods. Given the importance of early intervention, it is a mistake that can't afford to be made.
If parents are selecting multiple treatments that are not complementary, they could actually be preventing their child from making gains. There are 3 major things the parents should be looking for when they're looking for services for their child. The first is, what is the training and the credentials of the individuals that are providing the service? You absolutely want to have somebody with a master's degree doing the supervision. They should be visiting your home weekly to look at the program, to work with the therapist. They should be modifying the program on a weekly basis. You should ask the provider, what will the sessions look like in my home? So you want something that blends into your natural family routines, that looks more naturalistic, that allows the child to learn play skills and socialization, so that when they're entering school, they have a lot of those skills. And I think the third most important thing is asking the provider how they measure their gains. What kind of data are they collecting? Are they collecting data on a daily basis, on a weekly basis? And how are they measuring improvement?
One place where families can find such criteria is at Autism Spectrum Therapies in Southern California. Here, Dr. Ronit Molko and Dr. William Freya work with a team of over 200 specialists trained to provide optimal results for the children in their care.
We believe that all children learn best at play or in socially meaningful context. And that's especially important for children with autism, where their core deficit is in social understanding. That's what's impaired.
Too big. Good job.
At AST, we have 3 key elements that sets our therapy apart. The first is evidence-based practice. We use applied behavior analysis, which has an awful lot of research to support its effectiveness with kids with autism. And secondly, we embed all of those methodologies into naturalistic routines, well-structured and well-organized play routines that expand with a child's growth. And then third, we individualize every child's program. We don't believe that there's a specific curriculum that fits all kids with autism.
Once an individualized program is developed, therapy is conducted within the child's home. While this approach has many strengths, there are challenges that only the most qualified specialists can overcome.
Starting the program at home is really important because the child should be learning in their natural setting. The pitfall that sometimes families run into is that the program does not progress beyond the home. So it's really important that that parents work with their provider in the park, in the grocery store, in all types of community settings so that the child is generalizing those skills throughout their daily life. Our therapists receive a lot of intensive training and they receive ongoing training throughout their time with AST. In addition, we have 12 doctoral level professionals and 45 board-certified behavior analysts. So every child's program is supervised by a board-certified behavior analyst.
My husband and me are not experts in this field, but we are experts with our son, and we decided that we need to do what's best for our family. We tried every kind of therapy out there, and we observed that our son is most attentive and alert when he's in a playful environment. And so we decided that AST fits this philosophy very well. They have a lot of programs all delved into a play-based ideology.
After only 4 months of therapy, Annette Markosian has seen significant improvements in her son. She credits this to the collaborative support she receives from Matthew's therapist, and for the first time, she feels empowered.
We've seen tremendous changes in many areas of development, such as potty training, self-help skills, social skills, language acquisition and proper usage, and also a drastic reduction in echolalia and stemming. At this point, our son has acquired so many skills that we could generalize, that we go out more, we're less restricted, we know exactly what to do when there's problematic behaviors, we're better able to cope with certain skills, and we have better strategies and techniques to use when the therapists are not around.
Our mission at AST is to provide the best possible ABA intervention for children with autism across all ages. So whether that's early intervention, whether that's social skills, we believe that professional development, creating quality ABA therapists and teaching them how to do naturalistic interventions that have the biggest impact for kids is ultimately what's going to make the biggest difference.
The professionals at Autism Spectrum Therapies have also been working within the school system for years in developing specialized programs specifically for students with autism.
So we will work with classroom teachers, with school psychologists, and with aides within the classroom to structure a program for the child that facilitates their learning, enables them to participate in a mainstream classroom, and therefore benefit from interacting with typically developing peers.
Because of their commitment to creating leaders in the field of autism, AST has invested heavily in recruiting highly skilled master's and doctoral level professionals.
It really takes a very good and solid group of quality doctoral and master's level people to pull that kind of training off. We've taken everything that the ABA literature has to offer and brought that together to have a very comprehensive and unique play-based ABA approach to teaching children with autism. Our leadership sits on local and national committees. We publish research, we conduct research, and we stay on top of the ABA literature. So we really put a lot of time into training and developing ourselves professionally and staying current with the research so that we're offering our families the most up-to-date interventions that we can.
If I had a family approach me about AST, I would definitely tell them to consider them. The fact that AST focuses on a child's strengths rather than weaknesses, and they enhance all of their skills and they help them use those skills during playtime. It really helps the child to generalize into other areas of their life and to also maintain those skills through the course of the day when the therapists are not there.
For more information on the treatment options available at Autism Spectrum Therapies, log on to autismtherapies.com.